The next scenario we're going to look at is back pain, Cauda Equina. Cauda Equina, back pain. So this is back pain in a 70-year-old man. He has actually presented the back pain to the GP surgery or to the emergency department. So what's going to be your approach? You're going to take the history of the back pain as discussed in the general approach to back pain. Go through the differential diagnosis. You're going to do a systemic review. You're going to do the ICE. You're going to do the PIM of DOSA. What's going to be happening in this patient in this history is that this particular patient was actually a mechanic, was working on his car. He was lying down, and when he was standing up. When he just bent to pick up something, then he felt sudden onset of back pain. Since then, he has had other issues. He has not been able to open his bowels. He actually wet himself. He had one episode of urinary incontinence, was not able to pass urine, and was not able to open his bowels. He has got some weaknesses in the leg, and he feels some sensory loss as well. Okay. So when you take this history, that's what you would find. Yeah. It happened when you're just trying to bend down to reach out for something. He's an elderly person, so you would expect things like intervertebral disc prolapse that may occur, for example, without much stress or heavy lifting. Okay, he has been unable to pass urine since it happened, and as well as he has had a constipation, not able to open his bowels. He has weakness and sensory loss in the legs. You perform examination as discussed. What you're going to find in the same examinations, examinations are the same as discussed in the general approach. So what you're going to find in here is there's reduced reflexes bilaterally, reduced tone bilaterally, reduced power bilaterally. So all neurological examination of the lower limb in here are positive. And what you can see in here is things that are bilateral, suggesting more of what an Cauda Equina. Okay, so perectal examination. There's loss of perianal sensation and reduced tone. Abdominal examination, there is a palpable bladder because it's not able to pass urine. But the spine examination is normal. Diagnosis. He may have a disc prolapse when he bent down. That could have caused a disc prolapse, maybe could have caused a fracture, okay? A disc prolapse. That caused compression of the nerve. And now he has got what we call a Cauda Equina, most probably from the disc prolapse. Management. He has come to the emergency. This particular patient is an emergency department, okay? Not a GP, emergency department. We will do the routine stuff, the blood testing, of course. We need to catheterize the patient because on examination, there is the palpable bladder. He has got urinary retention. We need to refer this patient to orthopedics and explain what the specialist will do. They are likely to keep him in hospital, admit him. They may perform an operation, okay? They may perform an operation to relieve the compression of the nerve. Okay, so this is when one of the discs on the back slips out and compresses on the nerve. And as we said, commonly this is the intervertebral disc prolapse at what level? L4, L5, or L5S1, leading to what? Cauda Equina. So they have to relieve that pressure on the nerves, which is causing the problem, and they might need to undergo an operation. But before then, they have to confirm this. And the most diagnostic investigation is an MRI scan. If it is confirmed, he might need an operation. So we need to be referred to orthopedics for further treatment. Thank you.